Hello and a very warm welcome. Thanks for tuning in to News 9 Live. The COVID spike, the preparedness of all these hospitals, even as Union Minister Mansukh Mandavia chairs that high-level review meet, should you be worried? Has pandemic fatigue really pushed you to not wear that mask anymore? Are you fed up with wearing those masks? Well, take a look at this. The latest figures are definitely going to, well, scare you. On Thursday, India experienced an alarming surge in COVID-19 cases. 6,050 new infections reported, 13% higher than the 5,335 cases reported just the day before on Wednesday. Speaking of the national capital, more than 3,000 COVID cases recorded in Delhi in the past 1 week, while active cases have increased by over 121% during the same period. This is the first time since September 16th, 2020, that the nation has surpassed the 6,000 case mark. Union Health Minister Dr. Mansukh Mandavia held a meeting with the health ministers of all states and union territories on Friday to assess the nation's readiness. According to the data released by the Union Health Ministry, the death toll in the country is now at 5,30,943, with 14 new fatalities being recorded. The new variant too has come as a cause of concern. It leads to the same symptoms as the previous strains. Now, to decode what's really happening on the COVID front and our tackling and our battle against COVID-19, Dr. Suresh Kumar, Medical Director, LNJP Hospital, is soon going to be with us. And Dr. Rahul Bhargav, Senior Consultant, Fortis Hospital, Gurugram, is with us on the broadcast. Dr. Bhargav, help us understand, how are you reading the latest figures that are coming out? I mean, surely there is a certain spike, but the people on the ground, I mean, even during the second wave, even during the first wave, the Mahakumbh Mela, the Holy Festival, there were people who were quite openly flouting these COVID norms. Today, we're looking at 6,000 cases again for the first time after September 2020. Are you worried with how people are taking in these numbers, and how ready are we really?
So three parts to this. I think we are very ready. So we don't need to panic at all. And we need not bring those horrible memories from the Delta wave. The reason is because we are vaccinated. I mean, not one, two, but majority of people have got a booster vaccinated. So need not worry, and you're not going to repeat any of those horrible times what you had in Delta wave 1. Second, most sometimes the hospitals, the doctors, the healthcare personnel, the media, everybody have taken a deep surveillance onto this, and everybody is prepared to take any eventualities or any rise in cases, which if they happen during this next coming days. Third most important thing we need to remember that in 2022 in January, the Omicron, the so-called third wave came by. What happened? It was more infectious. It originated from South Africa. People said that R0 value for Delta was 6, but the R0 value, the ability to infect people is 26. So people did have COVID, and by 14th of February 2022, COVID disappeared. Then people said, fourth wave is supposed to come in September, October 2022. Some ripples did happen. Somewhere the COVID started rising and it came down. Now this XBB 1.16 variant, which has been pegged as Indian origin or international people saying that there are two more additional spikes to the protein, which might lead to more being infectious in nature. Agreed, it might be more infectious that if you are sitting in our rooms without the mask and without anything, without maintaining the proper distance, it might be infectious. But is it sufficient enough to lead you to the hospital? Is it sufficient enough to take that surge and lead you to the hospital, to the ICU, and then leading to the death? The answer to that, up till now, as we speak on 7th of April, the answer to that is categorically no. That common people are catching this flu-like symptoms, which has got an overlapping with H3N2,
right,
has been seen, but has not led to the surge in the hospitals. Not led to the people in ICU, and definitely has not led to the normal people dying because of the COVID problems, which we anticipated in Delta. So numbers are alarming. We need to be seen. We need to take precautions so that it does not become a become a viral important structure in the people's mind. It does not spread the way it has spread previously. And even if it is spread, the answer to that is we need not be worried. It is not leading to more hospitalization. But at the same time, we should take all our precautions so that in next coming 2 to 3 weeks, the spread of this infectious variant is curtailed and we can be back
Dr.
to
Bhargav,
normal without the
Dr.
mask,
Bhargav,
without
I,
that distance,
I'll,
and without
I'll,
hand hygiene.
what I'll do is I'll put the anxiety of all those people out there who are aware of these numbers. I'll put that anxiety in terms of a question to you. You drive to your work, right? I mean, I'm going to get to the point where I'll ask you what Fortis Hospital in particular is doing in terms of preparedness. But on your way to work, on your way to your clinic or the Fortis Hospital, you must see people on the road, right? You must go outside, buy groceries, vegetables in your local markets as well. Are you worried about the fact that nobody is wearing masks at this point in time? And I mean,
Yeah, so I
if
think
that is a cause of concern.
yeah, absolutely. These numbers are driving one thing for sure, that discussions. These numbers, the moment there's a surge, and the moment the Mansukh Mandaviya, Honorable Health Minister, has taken a cognizance of this fact that
Right.
numbers are driving, and we are discussing at the prime time at 5:30 in the evening, that is sufficient enough for the people to tell that the mask has to be brought out from the closet. These are the times where you have to start doing the same three old things, maintaining the 2 feet difference and maintaining the mask as well as the hand hygiene has to be incorporated again. You cannot let your guards down. The plain simple reason is because these numbers has got a propensity to increase rapidly. So
Right,
that is why
right.
we need to be aware and not panic. So there's a difference between aware and being panicked, because the moment we heard COVID, but the first memory which comes to our mind is simple as that of a delta wave. So that
Right.
we are saying nothing is sort of this going to happen. The hospitals are not going to fulfill. I mean, they're not going to be overflowing with sick people. Yes, at Fortis, the preparedness is ready. The isolation ward has started coming up back again. The high level of testing in those people coming with influenza-like illnesses, IFS, have started again, because 2 months back we were not testing COVID as rampantly as we are now doing. So these numbers definitely brings back the desired amount of regulations which are needed to control COVID in the future has been set in. The ball has set in rolling. We need to follow these orders for next couple of weeks before it settles down like the previous Omicron and the fourth wave.
Well, absolutely. Dr. Suresh Kumar, Medical Director for LNJP Hospital, also with us on the broadcast. Dr. Kumar, first and foremost, what is the preparedness level at the LNJP Hospital, again, a prime medical institution in the country, if not the national capital? And as well, at the same time, what is the opinion of the doctors community when vaccination fatigue is being spoken about? There is, complete inoculation of the first and the second jab, but the booster jab, suddenly people have become dubious about it. They're averse to, putting that particular booster jab as well. So what's happening at LNJP and the doctors community's opinion on the booster vaccination fatigue?
First of all, I must congratulate the team of Loknayak Hospital and Maulana Azad Medical College for successfully treating more than 25,000 COVID cases. Right now, we have 14 patients admitted in the Loknayak Hospital. We have earmarked 450 total beds, 400 isolation and oxygen bed, and 50 ventilator and BiPAP beds. So we have sufficient bed, and we have war footing preparation for this newer variant, which is XBB 1.16, which is creating a lot of problem in many states. And we have seen that the positivity rate in Delhi is also more than 25%. And if you see, the daily number of cases has gone up. And we have every day we are getting more and more sick patients requiring ventilatory supports, oxygen supports, and non-invasive ventilation as well. So if you see the preparedness for this current variant, we are fully prepared. We have received the guidelines from the Government of India, ICMR, and from Delhi government that we have to be fully prepared. We have already conducted a mock drill where we have seen that all the oxygen points, all the ventilators, all the machines in the hospitals are in the working conditions. All the isolation bed, ambulances, the critical areas are already on the high alert. And we have seen that most of these patients who are admitted in the tertiary care center in most of Delhi, or whether it is private or in the government or in the Loknayak, it is only those patients who have the associated illness like diabetes or cancer or TB patients or
Right.
Pregnancy. So these are the groups where you require the indoor hospitalization or ICU care. But by and large, those who have received two doses of vaccine or booster dose or precaution dose, they have only mild symptoms. So definitely we have the very high positivity, but at the same time, the number of patients requiring hospitalization is very less. 98% of all the LE beds which are earmarked for COVID are vacant. Only 2% beds are occupied in the LE.
Well,
So
that certainly
there is a need not
is a
to
great
be
statistic.
We need not to be too much panic about the hospitalization. We must focus more on the preventive part. As
Well, absolutely.
Dr. was
Prevention is better
just
than cure.
discussing that.
And we have Dr. Bhargav with us also on the broadcast. And both the doctors are telling us the same thing, that need not worry or panic about this. But Dr. Suresh Kumar, there's this recent data that has been released by a medical authority in China that is talking about the samples that were collected from a Wuhan market back in the year 2020. Now, there is no clear definitive answer about what we know about COVID-19. But in terms of battling COVID-19 as a virus, how much do we know about this virus? How much do we don't know about this virus? How long will what we already know help us in defeating this virus in the days and years to come?
Definitely, all these previous wave, first wave, second wave, or third wave, we are now better equipped. We have a better understanding of the viral dynamics. We have the availability of drugs. We have seen that there was the crisis during the second wave, Delta wave, that most of the people who were requiring oxygen therapy, they were not getting because we were caught unaware, and the large number of patients were there in the hospitals, and all the hospitals were getting more and more patients to give the oxygen and drugs. And like we had a tough time for the remdesivir, for the antifungal drugs, for the black fungus or mucormycosis. But this time we know that the guidelines have changed. We need not to give antibiotics. We need not to give too many drugs. Earlier we used to give many drugs, but now it's very simplified that we have to see that whether the patient have the severe disease or not, or whether the patient have fallen the oxygen less than 93% or not. And only two things are working. One is steroid, oxygen, and low molecular weight heparin. So now we have a sufficient database of treating 25,000 patients. So we are better prepared for any of the new variant which is coming in the national capital or all over India. We are now more experienced about this virus, and we all already know that this virus is continuously changing, and this variant is particularly the recombinant variant. It is not the just a deletion or addition. It is a altogether different variant, which means that this XBB 1.16 variant spreads very fast, and it overcomes the immunity. It also infecting the vaccinated population. That is the big challenge. It is also infecting those who have received third dose. So all of our patients who are admitted in the Loknaga already received 2 dose or 3 dose, but still they are infected and they have landed up in the ICU. So that is the matter of great concern. And all the protocols, all the recent guidelines, we are updating to all our doctors, to technicians and all our staff. And we are this time much better handling this virus. And as long as we see that virus is there in the atmosphere or in the country or throughout the world, it is going to remain for a longer time. It is not that it will disappear.
Of course,
soon.
it's not going to vanish into thin air. Absolutely. Even the WHO chief, he's on record to say that it's a moral imperative of China to come out with this study, even as the Chinese scientists have come out with that Wuhan study. Inconclusive, however.
That's right.
Dr. Bhargav with us also on the broadcast, senior consultant for Fortis Hospital. Dr. Bhargav, usually the only cylinders that make headlines are LPG or gas cylinders. Now, I remember in the last, waves, oxygen cylinders, these trains running from one end of the country to the other, these oxygen plants, that was making the headlines. In terms of oxygen availability, you know, we just had Dr. Suresh Kumar who was talking about oxygen availability, people wanting more ventilators and oxygen during treatment. Do you think on the oxygen front, we have enough to, well, breathe?
I think those horrible days are not going to come back again. So those are the terrible times. We were not vaccinated. We had just started the vaccination. We didn't knew much about the virus. And after Delta, if you see the last 1.5 years, the Delta was last year in 2021. It was by 8th of May, it was all over. And it has led many more casualties during that time in one month time. But if you see for 1.5 years thereafter, there has not been major casualties because the preparedness is there. So the oxygen is no longer going to be a problem because it's just not based on the cylinders, because the PSA plants which came up post Delta wave has been doing a tremendous work and has been able to supply the required amount of oxygen to people around. So first of all, those days are not going to come by. Even if they come by remotely, 1 in a million chance if we think about, then we are ready with this, because now we have got our majority of the bigger hospital has got an in-house oxygen capacity of 10 metric tons, which can be produced in a day. So the thing is, we are well prepared, need not worry. This one assurance we can give from the medical standpoint of view is that need not worry. The government is doing their job. The media is bringing the right highlights to the people that, yes, you need to be taking out your guards again. Need not panic, don't run, don't get judgmental about it. Yes. Third most important thing, the hospitals are prepared now. Every single citizen has to do their part of being a responsible citizen by wearing the mask for next couple of 2 to 3 weeks before the surge actually dies down on its own. So these will continue to come. These will create ripples thereafter every year by year, so need not worry about it. This can be also an opportunity to revaccinate people. The more important thing is, from a researcher point of view, is this a need for a yearly vaccination into elderly age group or diabetic or hypertensive or cancer or kidney or liver disorder people? Because we need to prevent every death which is happening from a COVID. So that's the second most important point which we need to answer is that do we require another booster dose to the healthcare workers and to this high-risk, so-called high-risk population? And the third and most important thing the researchers has to answer these questions is XBB.1.16, which is leading to the surge in the numbers, has been able to evade the immunity provided by two domestic in-house indigenous made vaccines, Covishield and Covaxin. Is that the scenario? Because to my mind, if the virus is able to evade the effective vaccination, then it is going to be a troublesome. Otherwise, need not worry, because none of the vaccines except the nasal vaccines promises of not having COVID, because still you can get vaccinated and still you can have a COVID. But what they promise is that they will not let you die and they will not take you to the hospital with the severe disease. So it's more important that we should take this opportunity to tell and drive
those are some great points
home to people that you need to get revaccinated.
Dr. Bhargav, those certainly are some clear-cut points. If any researchers watching this show at the moment do touch upon the facet of yearly vaccination, especially for the senior citizens as well. But, both the doctors on the show do stay on with us. We're looking at a daily COVID tally that has risen by more than 20% from the previous day. We've got reactions coming in from the Health Minister of Haryana, Jharkhand, the Chief Medical Officer of Aligarh as well. Let's quickly take a look at those reactions and we'll go back to the doctor.
सारी हमारी जो लैब्स हैं RT-PCR हमने हर जिले में लगा रखी हैं, सारी हमने दोबारा फंक्शनिंग करनी शुरू कर दी हैं और वैक्सीनेशन का मेन अब इशू है जो फर्स्ट डोज है हम 103% लगा चुके हैं, जो सेकंड डोज है वो हम लगभग 2,30,00,000 लगा चुके हैं, तो 86%। जो प्रिकॉशनरी डोज है वो कम लगी है, तो अब हमने ऑर्डर दे दिया है बाज़ार में वैक्सीन खरीदने का। वैक्सीन आ जाएगी, जैसे ही वैक्सीन आ जाएगी लगाएंगे। और हमने देखा था कि उसमें लोगों की तीसरी डोज लगाने की रुचि कम है, तो हम जो भी वैक्सीन लगवाएगा उसको हम कोई ना कोई हेल्थ सप्लीमेंट साथ देंगे।
राज्य पूरी तरीके से तैयार है और राज्य अपनी एसओपी भी जारी करेगा और राज्य जो है अपनी एसओपी भी जारी करेगा कि हम चूंकि हमारे अनुभव इसमें अब तो हम कोविड से 1-to-1 फाइट करने में सक्षम हो गए हैं। पहले था कि हम एक ऐसे युद्ध में थे कि हम दुश्मन को पहचान नहीं पा रहे थे, लेकिन अब हम इतने हैबिचुएटेड हो गए हैं कि अब हम कोविड को आसानी से परास्त कर सकते हैं। ये सारे लोगों में ये क्षमता आ गई है।
आज हमारे 4 केस हैं जो मैंने अभी आपको बताए हैं। हाँ, माननीय भी इसमें है और 9 तारीख को वो भी डिस्चार्ज हो जाएंगे। ये सभी केस जो हैं वो पूर्णतः स्वस्थ हैं और गाँव में रहकर ही अपना स्वास्थ्य लाभ ले रहे हैं। जो भी कोविड प्रोटोकॉल का पालन कराया जाना है टीम की देखरेख में वहीं कराया जा रहा है। बाकी हमारी टीमें जो हैं वो जांच भी कर रही हैं। जांच के बाद अगर कहीं कोई पॉजिटिव आ जाता है तो उसको ट्रैक भी कर रही हैं, ट्रीट भी कर रही हैं और ट्रेस भी कर रही हैं, क्योंकि जो कॉन्टैक्ट्स हैं उनका भी सैम्पलिंग होना ज़रूरी है। मैं जनपद वासियों से यही अपील करूंगा कि जो कोविड प्रोटोकॉल है उसका अक्षर से अनुपालन करें और यदि जरा भी उन्हें इस तरह के लक्षण लगते हैं तो वो तुरंत अपनी जांच कराएं ताकि समय रहते उसका संज्ञान ले उपचारित किया जा सके।
Well, sir, Dr. Suresh Kumar, Medical Director, LNJP Hospital, I'm going to let you have the last word. We just heard Anil Vij and the other Health Minister and CMO of Aligarh as well. And Anil Vij talking about, कैसे तीसरी vaccination dose लगाने में लोगों की रुचि नहीं है. Now, we did talk about pandemic fatigue. We have urged people to step out and put the, get themselves inoculated with the third dose as well. But on the ground, during the last waves, and Dr. Bhargav has been quite rightly putting it forward that we must not bring back those horrid memories, but we must, learn from those memories at the same time. Now, Dr. Suresh Kumar, during the first 2 waves, we had the executive, the bureaucracy, the police members, all on the ground, helping us out, letting and making sure that people don't flout these COVID norms. Do you think that's not happening? Do you think the government of, various states and the central government should be more fast in their actions, should be more swift on the ground?
You see, it's a moral responsibility of every citizen to follow the COVID protocol of their own. There should not be any force to use. We can't use force that you wear the mask and you do this and you don't do this. It is better if we do it voluntarily.
But doctor, that doesn't happen. Doctor, that doesn't happen voluntarily. It will never happen. We've already seen so many places. I mean, these Kumbh Melas and various festivals, religious festivals, these political campaigns, elections are right around the corner in various crucial states. Without the executive on the ground, voluntarily, they are not going to be able to do it.
No, but if you see the WHO advisory and global, most of the countries, they have not forced the compulsory masking, because if you are already immunized, if you have already exposure to 2 dose or third dose, then the chances of disease severity are very, very less, and
all right,
you don't have the severe impact of this newer variant. So it is always better that we do it on the voluntary basis. And if you have a very high hospitalization rate, or if you have very high death rates, so far the deaths are less. As we have seen that if you just see the data of Delhi, we have a 0 death, only 1 or 2 deaths in just 2 days or 3 days. But deaths are seen only in those population or subgroup where you have the other disease leading to
all
death.
right.
That's like cancer or liver disease or dialysis patients. So
right,
we have to be more careful. We have to
well, doctor,
follow the guidelines voluntarily. But it is a policy matter that if government top level, its decision has to be taken at the highest level.
Well, absolutely, Dr. Suresh Kumar and Dr. Rahul Bhargav. It has been a riveting conversation. Thank you so much for joining with us and helping us out with your insightful inputs. Well, both the doctors on the panel suggest that we don't necessarily need to panic at the moment, but at the same time, precaution is better than cure. Please pull up those chin diapers from your chin up onto the nose. Masking up is but necessary at this point in time. High time we pull our socks up. Please don't flout COVID norms. Don't step out until it's absolutely necessary, and at the same time, stay safe, stay at home as long as possible. That's all the time we have for you this episode. We're going to continue to track numbers on this COVID spike. You can log on to News 9 Live for all the latest details. Thanks for watching.